The death by suicide of Robert Carradine sent shockwaves and deep sorrow throughout our community. Robert Carradine struggled with bipolar disorder for nearly 20 years. Hello and welcome to the Dr. Suzette Glasner podcast. Don't forget to hit like and subscribe to my YouTube channel if you haven't done so already. And if you have any questions for me after this episode, or if you want to suggest a topic you'd like me to cover or a guest you'd like me to bring on, please feel free to email me at askdrglasner@gmail.com. I would love to hear from you. Carradine was 71 years old and was best known for his roles on Revenge of the Nerds and Lizzie McGuire, a beloved father, grandfather, uncle, and brother. Robert Carradine struggled with bipolar disorder for nearly 20 years, according to news reports. We know from research that suicide attempt rates among individuals with bipolar disorder are at least 20 times higher than in the adult general population, and they are nearly 50 times higher in youth populations with bipolar disorder. So the discussion on social media around this and other recent suicides, including the passing of Catherine Short at age 42, daughter of actor Martin Short, has revolved around one question, which is what can we do to help those who find themselves in this really dark place to prevent this? And today, to answer this, I'm going to reflect on my recent conversation with Emmy Award winning actor Maurice Benard on his podcast, State of Mind, where he really went there with me and talked about things that are really difficult for most people to talk about, both because they're frightening and feel really dark, and also because for some people there's a lot of shame and embarrassment around this topic. We talked about the times in his life when he didn't want to be here anymore.
There was a tree in front of my house that I said, it had a rope, not a rope, it had something on it like a chain. And every morning for 4 months, I'd take a walk, crying, bawling, and looking at that tree and thinking, do I have the guts?
So the fact that he's talking about this on YouTube is really a model for us to follow. And when I say us, I mean both those of us who work in the mental health treatment community and those who have lived experience with mental health struggles and suicidal thoughts and behaviors in particular. The reason I say that this is a model to follow, there are actually 3 reasons. The first is because people who survive a suicide attempt say that something that could have helped them was talking to someone about it. And that bears out in research studies, which I'll talk about. Second, because suicidal behavior is judged and stigmatized societally. And that's part of why we're not as successful in preventing it as we could be, because that also suppresses people from feeling comfortable talking about this topic. And then third, Maurice is someone for whom doing these preventive actions of talking about it, reaching out, and really having a forum and a safe space to do so is really critical, because as someone with bipolar disorder, he is part of one of the highest risk groups for suicide. So we know that globally, about 15 to 20% of people with bipolar disorder die by suicide, and 30 to 60% make at least one attempt in their lifetime. So how do we help avoid this? First of all, understanding some of the risk factors for that. Within bipolar illness, there are some risk factors like a family history of suicide, experiencing mixed episodes where a person alternates between feeling manic-y or sort of euphoric or up mood, and feeling down or dysphoric or depressed. Those are some of the risk factors. Longer duration of an illness of bipolar disorder is another risk factor, and substance use is a risk factor as well. Thinking more broadly about how we help avoid this, beyond understanding your risk factors, we can't talk to people who have completed suicide to ask them what was going through their minds, obviously, because they're not with us anymore. But the best sources of information to fill the gaps in our understanding of the high rates of suicide and bipolar illness are the people with bipolar disorder themselves who survive suicidal incidents. And I mean survive whether or not they made an attempt. So whether or not they acted on or averted acting on plans or intense thoughts about harming themselves. So here's what Maurice shared about this.
Never forget one time I was trying to play with the goats and stuff, and I just couldn't do it. And I was running to the tree, and I stopped and I prayed. And I remember seeing my family and thinking, no lie, that if that happened, it would give the people who watch State of Mind the green light to do it. And I didn't do it. But boy, it was tough.
So we talk about cancer survivors, but not so much about suicide survivors. Maurice is a suicide survivor. Some of you watching may also be or may know other people who are. And something we know about bipolar disorder is that people will alternate between a state of mind that is depressed, not exercising very good judgment, and not able to really self-reflect, and periods, and these can be long periods of stability where a person can reflect on the time when they were feeling unstable, when they were feeling perhaps suicidal, and really articulate what it was that was going on with them and what could have helped them. If you're somebody who's in a good place but has been suicidal in the past, you are a survivor like Maurice. And you can leverage your healthy and stable state of mind to plan right now for a future that's free from self-harm. So using Maurice and his bipolar disorder as an example, Maurice is pretty rational and self-reflective now that he's out of that depressed mood state. And that means he can tell those around him what he was going through, what he was thinking and feeling in his darkest moments, and what he needs to get to a better place if he's suicidal in the future. And that's what I noticed when I spoke with him about this. He was clear. He would need 3 things. The first is to know that he's not alone and to talk to someone about it.
Are valuable because whoever is out there suffering can look at this show and go, oh, I don't feel so alone, and it's not the end of the world. That's what I think suicide, the dark side, all that stuff. We have to make it to where it's not the end of the world. We can talk about it. That's, it's the people that don't talk. I'm talking right now, so I'm drinking too much coffee. It's the people that don't talk about it that get themselves in trouble because they bought all that in. And then they got no outlet, nobody to talk to about it. And it can get sticky.
And now what he's describing is exactly what studies of survivors show, which is that one of the things they say would have helped them decide not to attempt is having someone to talk about it with. And this is important because people are often afraid to bring up this topic, especially if they're not mental health professionals, because they sometimes worry that they're going to give someone an idea about self-harm as a way of coping. And the studies really clearly show, this has been studied many times, that talking to someone about suicidal thoughts and behaviors actually reduces the risk of them making a suicide attempt. It is not the opposite, which some people intuitively think that it's going to increase risk. It actually reduces risk. So that was the first thing he would need. He would need to know he's not alone and to talk to someone about it. The second thing he would need was to be reminded of certain things, like his family and his State of Mind podcast audience, has really come to rely on him in very healthy and positive ways. And this is also consistent with studies of suicide survivors for whom what made a difference for them was thoughts of not seeing their loved ones again, thoughts of missing out on ways that their children, nieces, nephews might be growing up and experiences that they were having. And importantly, the fact that even the worst moments of suffering do pass.
Now look what happens. Because I move forward, and I'm not exaggerating. This is a guy who didn't think he could go on another day. I won 2 Emmys. I wrote a New York Times best-selling book, and I created State of Mind. That's all after I didn't think I could go on. We never lose hope. Hope is so important. No matter what you're feeling, never lose hope.
Hopefully he never does. But if Maurice does go back to a dark place, and we know the course of illness of bipolar disorder can be up and down, that's expected, right? But if he does go to a dark place again, he might need to be reminded of what he just said to me on his podcast. And for anyone who's struggled with suicidal thoughts in the past, or for whom a loved one has, this can actually be part of the strategy for safety planning. You want to do this in cooperation with or in collaboration with a mental health professional, but you want to help the person to document what the warning signs are when they're going to a dark place. And importantly, for what you need people close to you to do if those signs come up. So it's something you can make a plan for together with your loved ones, your doctor. If you haven't done this yet, you might want to watch this episode together with them just to show them what you're talking about and sort of go from there. The third thing is that Maurice recognizes that staying on his treatment regimen, which for him, at least at the time of our conversation, was lithium and Lexapro, is vital.
How long have you been bipolar? I was diagnosed like at 22 years old. Okay. I'm going to put you on Lexapro. I said, what's that? It's a medication that will help you through these times. I said, all right. And got me through. Pretty much saved my life, I believe. Lithium and Lexapro saved my life.
So Maurice is right, more so than many people realize. There have been studies of the impact of various medications on suicide risk in bipolar disorder specifically. And the one medication and relatedly the class of medications to which it belongs that have been found to be protective against suicide, reducing the risk of suicide in bipolar disorder specifically, is lithium, which is what Maurice is taking. There was a study that summarized the data from 34 different clinical trials of long-term treatment with lithium for a major mood disorder, not just bipolar disorder, but mood disorders as a whole. And the rates of suicide and attempts were 5 times lower during treatment with lithium compared to other treatments or no treatments for people with a major mood disorder. When you looked at bipolar disorder, the odds of suicide and attempts were 6 times lower for those who were taking lithium. And this also corresponds with a set of recent studies where autopsies were performed on individuals who died by suicide with bipolar disorder. And what they found was that the majority, at least 70%, were not taking their medication consistently or at all, and many were not on the most effective medications for bipolar disorder that have been established in clinical science, like mood stabilizers. So it's really important to have a trusted, specialized professional helping you manage bipolar disorder because it literally can make the difference between life and death. Another reason that we're seeing high rates of suicide in bipolar which are actually, even though we know that they're high, they're probably even underestimated, is because the diagnosis of bipolar disorder is notoriously problematic, with an average delay of about a decade between seeking help and getting a diagnosis. So if you know someone with symptoms, seek out a qualified professional as soon as you can to help them get diagnosed and properly treated, because that's a really high risk window for a person who is living with active bipolar disorder that's not treated, and likely contributes to the high suicide rates and the lower life expectancy rates of as many as 20 years less than a person without bipolar disorder. A lot of that is attributable directly to the heightened risk of suicide. If there's one thing you take away from our conversation today, it's that we should really follow Maurice Benard's example around being more open and talking about these very difficult experiences, so that the other people who are having these experiences don't feel so alone, and so that we can help ourselves when we are feeling vulnerable. So here's where talking about it was an experience that came full circle for Maurice Benard later on.
And he's like, "What's wrong?" I said, "I'm not going to make it, man." He goes, "Yes, you're going to make it." I said, "No, I don't think so." And he says, "Yes, you are. I know you are." Okay. Well, fast forward a bit, a couple of years later, I'm on All My Children. And I come back to the hospital because they were going to do a 20/20 on me. No, this I've never talked about. They were going to do a 20/20 on me. They interviewed me, just like Oprah. It's like movies to get these things. They have to interview you and stuff. They interviewed my mom and dad, and Paula, and everybody. And I was ready to do it. So I went to the hospital, and the first person I saw was that doctor. He's kind of like a nurse doctor. Mm-hmm. And I said, "Hey," he goes, "Hey, big shot, you made it, huh?" And I said, yeah. I said, "How did you know?" He goes, "Well, because I was in a mental institution in Vietnam for 1 year. If I could do it, you could do it."
Let's keep the conversation going. I hope you learned something valuable today, and I look forward to seeing you next time. If you or someone you know is in a crisis, please know that you can call 988 or chat at 988lifeline.org. The Lifeline provides free and confidential support to people in suicidal crisis or emotional distress 24 hours a day, 7 days a week across the United States. I've provided some other links in the description of this episode for anyone who needs more resources to support their mental health.